Hi, I'm Paul Sher. This is Asian Culture in America. Today we have a show and we think about pain. Pain comes in many faces. There's the pain that enters your body, enters your mind very briefly, excruciating, and disappears as quickly as it entered. We have the pain that enters into you, into your life, and then shortly disappears, but only to return again very quickly. And this could go on for a long time, or it could never be seen again, perhaps to be replaced by a different pain. We have pain that lingers for years sometimes, and people often say, you have to learn to live with it. And of course, the medical profession, the alternative medicine people, the shamans, the healers of this world say, that's silly. There is no reason for a person to live any part of their life with pain. This is what we talk about today, the chronic pain, the long-term venture into excruciating pain or numbness of pain, and how we get rid of it. I am at the Somerset County Chiropractic and Acupuncture Center here in Somerville, New Jersey, headed by Dr. James R. Golding. You've seen him on my show before. He's a knowledgeable, interesting, professional person. We're going to show acupuncture techniques of different kinds, not just the needle, but some laser acupuncture treatments, and others. And with me here to help out for the show is on my left Lisa Rippey. Right? Where are you from, Lisa?
I'm from Island Park, New York.
Island or Highland?
Island.
Okay. Mm-hmm. She is also an acupuncturist. She is also a model. Is that right?
That's correct.
Okay. And something else you mentioned, but I don't remember.
I'm a massage therapist.
Massage therapist, okay. And that'll be another show. Right? And on my right is Wendy Boehner.
Hello.
Okay. And Wendy is, in her own right, a famous artist. She has designed jewelry. What was the one you told me? Network Chiropractic?
Logo for Network Chiropractic, yes.
Which is now used worldwide. And I want to thank you both for coming out to help me, because I don't feel I'm going to be treated today. I'm going to be the host. Okay?
Okay.
And you too, thank you very much, and thank you for holding my hand, because I was a little nervous.
My pleasure.
I'm going to introduce you now to Dr. James R. Golding. If you haven't seen him before, you will meet him now on this show. And we're going to discuss acupuncture and the many ways to use it to help out and treat the long-term pain. Well, Dr. Golding, again, thank you for being on the show. The others were very interesting. I'm sure the viewing audience is going to enjoy this one and learn something about acupuncture. What are we going to see tonight?
Master Sher, it's always a pleasure to be back, and what we're going to see this evening is that we're going to demonstrate 3 different forms of acupuncture. One is needle acupuncture, the second is electroacupuncture, and the third is laser acupuncture in the treatment of chronic pain.
You said like needle acupuncture. This is what we've been doing. This is what
Yes.
is typical, right?
Mm-hmm.
Okay.
And millions of Americans suffer from chronic pain. The onset of that pain may have been originally caused by a trauma. It may be caused by arthritis. It may be caused by degenerative changes associated with aging. It could be an autoimmune disorder or an infectious disease causing something like Lyme's disease. What we're going to do tonight is attempt to demonstrate the treatment of pain associated with these conditions. Some people have pain that comes and is going to go away and is going to be cured through treatment of one form or another. There's many people out there that suffer from chronic pain upon which there's no cure for, but that their pain in and of itself becomes something that needs to be controlled and managed.
Dr. Golding, you mentioned trauma in various forms. With the treatment of acupuncture, we're talking also about the pain that comes from the emotions.
Why, yes, it can.
Mm-hmm.
Yes, it can.
Is this common?
It's very common. It's increasingly common that people will utilize acupuncture as a treatment for emotionally based disorders. It's not a replacement for psychiatric care. However, it does elicit profound change in individuals.
Mm-hmm. Okay, so what's coming up here now?
What we're going to do is that to make it easy for demonstration tonight, I've broken down our demonstration into 3 units. One would be head and facial pain. Secondarily would be neck and back pain. And third will be pain associated with the legs.
Okay, now we have the 2 women, Wendy and Lisa, to help us out here, right?
They are going to be our models tonight.
Great. That puts me at ease, because last time you had me. Okay. All right, what are we going to do first?
First we're going to do neck and back pain.
Mm-hmm. All right, do you want to go in? Is it going to be done here in this, or are you going to go into a treatment room?
No, we're going to go into a treatment room which I have set up.
Okay, good. Well, then we can start, huh?
Okay.
All right, let's go. Well, Dr. Golding, I see we have Lisa here, all ready up to do something. You told me this was for chronic pain, okay, or the relief of. And what indicates that acupuncture would be the way, the technique to go, the treatment to go to?
What makes acupuncture such a good technique in dealing with chronic pain is that, number one, acupuncture is safe. Secondarily is that there's no contraindications to medication associated with acupuncture. Third is that there's no side effects, as there is many times with medication. Fourth is that many times it will actually enhance the medication, meaning like in acupuncture anesthesia in China, when a person will normally need half the amount of anesthesia that they would normally use when not having acupuncture done simultaneously.
Okay, well, unlike anesthesia, okay, this is, how does this work for pain?
It helps to alleviate and correct pain syndromes by numerous different ways. Number one, it helps to increase the normal flow of energy throughout the course of the body. When we have blockages of the normal body's energy in a given region, the blockages become the source of the pain. The Chinese refer to this as a blockage in the normal flow of qi in the body, or in the meridians or channels that flow in the body. When these blockages are removed, the pain, the normalizing of the blood supply, the normal functioning of the nerves gradually begin into the area. The other thing is that it lifts up endorphins chemically. Endorphins are a hormone that your body creates that helps to eliminate pain and also gives the body an overall sense of well-being, similar to what you would experience after heavy exercising. The other way in which it works is that we can needle along nerve distributions and actually block the pain fibers in the nerves. These blocking of the pain fibers can stay for quite some period of time. The other way in which it works is that it has a natural anti-inflammatory effect. Many times when we reduce swelling in a given area, pain naturally subsides with the swelling.
Now, would these be left on for a long time, or is it typical of the 15-20 minutes?
Usually when I'm treating chronic pain syndromes, the patient will be under treatment for 45 minutes to approximately an hour. And the reason for that is that we want the chemical effect to have as long a period of time to take place in the person's system. Also, we want to maximize the effect of the acupuncture. The only time that we would do it for less period of time, as you'll see coming up, is when we do electroacupuncture, and that stimulation won't go on for that longer period of time. We have Lisa in this position today because we're demonstrating a treatment for mid-spine and lower back pain utilizing normal needle acupuncture.
Why so many? Or isn't this a lot?
Usually when in general, we don't use this many needles in the average acupuncture treatment. But I found that in treating chronic pain, you need to release the muscles or release the areas of constriction, and we are attempting to alleviate the pain by all of the ways in which I said before. So it usually requires a lot of needling. What I'd like to demonstrate to you now here is that Lisa has a chronic problem in her upper mid-spine, which a lot of people has, and she has what they call trigger points. These trigger points are areas of constriction within a muscle that stay tight for a very long period of time. This is caused by specialized cells within the muscles called spindle cells that are like little springs. And when those little springs draw tight and tight and tight, they make a spasm occur at a repeated level in the area of the muscle. This muscle becomes constricted and tight for such a long period of time that it becomes fibrous in nature and then also starts to radiate pain to given regions of the body. So she gets radiating pain into her upper extremities that is caused by constriction of these chronically tight muscle areas. What I'd like to show you now is what's called a trigger point release utilizing acupuncture.
Okay, these trigger points, these are still acupuncture points, right?
Well, no, these are not necessarily designated acupuncture points as these other areas are. These the Chinese would refer to as ashi points, but in Western culture, a trigger point is a point in which when we apply the pressure to that point, it reproduces that radiating pain. And by needling the trigger point, it eliminates that reflex which chronically causes people to have that pain. Many times a person has gone and they've massaged the area or applied heat to it, but they've never really gotten rid of these pains because they do not change the mechanical wherewithal that deal with these spindle cell apparatus in the area. What I'm going to show you right now is an actual trigger point release of the trapezius and the rhomboid major muscle.
She's feels and looks very relaxed. Is that what it is, or do you think that she's sleeping at this point?
Mm-hmm.
Lisa, how are you feeling?
Pretty relaxed.
You relaxed?
I could go to sleep.
Yeah? Well, she's allowed to, is she?
Oh, she's certainly allowed to go to sleep.
Okay, well.
Acupuncture treatment is relaxing, and the chemical effect when we're using this many needles comes over the body quite quickly, and the patient starts to feel a anesthetic quality to the nature of what's going on. If you can see, different from just putting the acupuncture needles in before, what I'm doing is I'm manipulating the needles. And the reason for the manipulation of the needles is that we have to get that point to cause that fasciculating release of the muscle, which breaks that whole pattern of chronicity causing her pain.
Should she feel something when you're doing the trigger points?
Yeah, as opposed to the regular needles, which originally feel like a dull ache and then gradually feel like an anesthetic quality come into the area. A trigger point release, the patient will feel some sharp tenderness, and they'll feel the muscle go into like a little quiver, and then the whole area will relax and release.
Okay. I'd like to ask Lisa, is this what you're feeling?
Mm-hmm. Yeah. Exactly.
What is it, in your words, what does it feel like?
It feels like my muscle is releasing, moving.
Another thing that I'd like to say is that within this treatment, within this standard acupuncture treatment, standard needle treatment, we have what's called local treatment and we have distal treatment. Distal treatment is acupuncture points that are far away from where her actual pain source is. But some of these points that are far away that I have needled into her legs and down by her feet have some of the strongest effects on her condition in the back. So although these were needling in and around her areas of pain, the parts that I've needled far away are having equal to, if not greater, impact on the condition, separate from the trigger point release.
Now, doing the trigger point release, okay, is this normal that the acupuncture points are being treated, then you do the trigger, then you remove the trigger? The pins?
Usually what I'll do is I will start a regular acupuncture treatment, and then as long as where I've needled is not in my way, I will work in the areas of interest that need to direct manipulation of the needles on a more standard manner.
So the needles and the trigger points stay there?
They can be taken, once that muscle releases, the needles can literally be taken out at that point because the job is done. Sometimes I will leave the needles in if I'm going to leave the rest of the needles in so that it increases the chemical effect that I wish to desire, chemical and anti-inflammatory effect I wish to desire in the rest of the body.
What are the symptoms of that the pain is going away? Do you have to rely on the patient to tell you something, or you just this is what's happening?
When you do a correct trigger point release, the practitioner can actually see and feel it, and the patient knows it at the time because it's almost like a whoa. They'll feel an expansion of the musculature in the area happen, and it's quite it can be quite a dramatic thing because a person will feel that constriction had been there for so long that it actually becomes adhesed into the area, and we've now opened that whole channel up in the body.
Okay, are we going to leave these needles in and go to something else? Ah, I see you have what looks like an ear.
I brought my demonstration of an ear in with our session here today because it's very important that we incorporate the use of ear acupuncture, which is also known as auricular medicine or auricular therapy. We have been needling portions of inside her ear in this region that correspond with given regions of the spine. There is within the ear points that will relate to different areas of the body that we wish to relax or sedate. When we needle these areas of the ear, it causes a reflex back to the vagus nerve. The vagus nerve is a cranial or head nerve that's frequently involved in pain syndromes of the body. By specifically relaxing that portion of the nerve, it has a sedating effect on the given area in question. So we will do auricular medicine, we will do regular meridian-based acupuncture, and additional trigger point releases, all within the same treatment for neck and back-related pain syndromes.
Okay, is pretty much this is it, or is this going to become return?
No, I mean,
indication?
Usually when you get an effective trigger point release, it is rare that you need to continue to release it. Only if it's over a large area, you may need to go back and work on some areas that did not release completely. And that's all that we needed to show for the back treatment today.
So we can leave her here and then go on to something else.
Yes, we can.
Okay, well, it's very interesting.
The next thing that I'd like to demonstrate here tonight is a treatment for head and facial pain. Many people experience chronic facial pain, chronic trigeminal neuralgia, facial pain, chronic teeth pain, occipital pain, and this is a treatment that is going to be for that chronic facial pain. Number one is that we do a lot of local needling of the involved area, depending on where the pain and the particular type of diagnosis that's involved. Secondarily, we are always going to overlay by doing the auricular medicine or ear acupuncture to the corresponding areas of the head and face. Third, we are going to do meridian-based acupuncture, and it is very, very important that we manipulate the needles in doing the meridian-based acupuncture so that to get the chi or the movement of the blockage of pain out of the involved area. Lisa, tell me when you feel a sharp tenderness.
Okay, now.
Okay. And what we'll do is intermittently during the course of the treatment, we will manipulate this needle, which will influence the nerve supply into the head and face. This is known as large intestine 4, one of the strongest acupuncture points in the body for head and facial pain. These 2 points here are for sinus dysfunction. These points which you're demonstrating here are to affect the 5th cranial nerve, which is involved in trigeminal neuralgia. This would be treatment areas for a frontal headache. The other thing that I wanted to demonstrate here tonight is this is a Helium-Neon acupuncture laser. And this is used for number one, in chronic pain cases, this helps us to alleviate the pain. Instead of using a needle, we're going to use a laser on the pain and acupuncture points that we would normally stick the needles in. This is a very, very effective tool for that. This is also a very effective tool for people that may be needle shy and uncomfortable with the idea of getting acupuncture needles stuck in them. This is also very good for children. This is a experimental tool. It is used in conjunction with regular meridian-based acupuncture and electroacupuncture. Now what we would do is we would apply the laser light on the actual point where we would normally stick the needle. The acupuncture laser stays on that point for 8 to 10 seconds before we move on to the next point. What we're doing on her now is all head and facial regions associated with her condition. Acupuncture laser treatment has been used in China for the past 30 years, and they've been getting very, very effective results with it. Normally the nature of this treatment will take anywhere from 45 minutes to an hour, as with the chronic back pain. Also, keeping in mind that facial pain may take slightly longer period of time to heal as opposed to other areas of the body, because cranial nerve involvement it's a slower healing process than the distal nerve supply of the body. So we can't affect it quite at the same rate. Okay?
She's feeling no pain. Right? Comfortable?
Very.
Huh? How about your feet?
Feet are warm.
Okay, what I'd like to do at this time, we're going to move on to treatment of leg pain in our next room.
Well, we're here in the treatment room again, and this time we have Wendy Boehner helping us out. And Dr. Golding here is going to show us the use of electroacupressure. These are the needles that will be electrified, and you're going to tell me why.
Wendy's being treated for bilateral arthritis of the knees. It runs in her family, and she is affected by both swelling and pain upon weather change. What we found is that she has an underlying arthritic condition of the knees, and utilizing regular acupuncture alone would not effectively treat her condition in a reasonable period of time. So the reason why we are putting a mild electrical current into the needles is to help and promote the process of healing at an accelerated rate. It's especially effective for a condition like this when the joint is really large and when the joint is really deep. What I've also demonstrated here is that she had a weakness in a muscle called the anterior tibialis muscle. We're using electroacupuncture to stimulate the muscle to contract in the involved area, the total length of the muscle, so that it will help to educate the muscle into a stronger configuration and thus promote healing.
The doctor said mild. What are we looking at? What kind of currents are here?
Boy, Paul, I don't remember the frequencies. I used to remember that when I was in school, but I don't remember that currently. But this is an electroacupuncture machine that's quite popular and quite effective.
Is this common, or is this used rarely?
I would say direct needle acupuncture is used more frequently than electroacupuncture, which is used in specific application. So there's indications for it, and that's when we do it.
Well, let me ask Wendy here. You have to sort of talk into my mic, into my chest, all right? Okay, you awake?
I'm fine.
Yeah. What are you feeling at this time now? What changes? Anything going on?
Little tingling sensation.
Uh-huh.
Nothing that hurts. Put it that way.
Yeah, you didn't seem as relaxed as I saw Lisa. It's too short a time.
I'm usually not a needle person, but
Oh, okay.
I'm handling needles.
When you use the electro acupuncture treatments here, okay, is this the same? I always ask you about everything. Is you're going to leave her here for X amount of time, or this is it?
Usually a treatment like this would last about 20 minutes. We would check on the patient intermittently to make sure that that they're comfortable with the electrical frequency going into the involved areas. Sometimes we'll adjust it during the course of the treatment, because what will happen is that it'll initially, when the current goes through the acupuncture needle into the body, it'll seem strong, and then it'll die down and it'll hardly feel like anything. So then we come and we increase the frequency to bring the tolerance up of the body to stimulate as much change as we can.
Oh, I want to ask, who are you? Okay, Lisa, you're practicing acupuncturist. Okay, do you use electroacupuncture?
Not too often,
Too often.
only in the case where I can't get a response from a patient. And it's like Dr. Golding said, that it's so chronic that you can't get a response in a reasonable amount of time.
Okay, so she's saying sort of a last resort. Are you saying pretty much the same, or do you use this when it's indicated?
More when it's indicated, but certainly in tougher cases, and the reason for its demonstration today, in chronic pain cases, we don't want to hold back any tool that we have that can stimulate change in the shortest period of time. People they've lived with the pain long enough, and even if we may not be able to eliminate it totally, if we can take them from dysfunctional pain, intolerable pain, to making the comfort that they experience and getting a percentage reduction of the pain, if it's 10%, 50%, 60%, sometimes we're happy with getting a mild to significant reduction of the pain without the goal always being the elimination of the pain.
Okay. I'm going to ask you a question based on the previous shows that we did with you. This technique, acupuncture, excuse me, going into my own field, and the moxa on the needles, is one stronger than the other, or is there any relationship? Or
They are related techniques, but the difference is we would use the moxa on the needle, as we demonstrated before, when the patient has what's known as a cold condition in the body. When their presentation deals with a sense of coldness in the area, and we want to bring heat on a deep level into the meridians or channels of the body. Electroacupuncture deals more with stimulation than the application of heat.
Okay. Well, before I say thank you again, okay, I want to thank the two women. Wendy, the artist.
Yes.
Okay. Lisa, the acupuncturist, the model. What was the other one?
Massage therapist.
Massage therapist. And we don't have time for her to do me, so we'll have to just maybe wait for another show, right? And you, most of all, for helping Asian Culture in America show. You've done so much.
Thank you very much, Master Sher. It's a pleasure being on the show.
And this is Dr. James Golding here at the Somerset County Chiropractic and Acupuncture Center. Haven't mentioned it before. He is also a practitioner of Chinese herbal medicine, which if you've seen the show on it, you'll know. But look for it. Again, great. All right? Thanks a lot. Now we can go look at the camera. Yeah, I like the colors that you use.
How are you feeling? It is my heartfelt desire that people that are experiencing chronic debilitating pain consider acupuncture and Oriental medicine as an adjunct in their care and treatment. Many times it can significantly reduce your pain and suffering, It may additionally help with any medicines that you may be taking. Incorporating this along with Western medicine and alternative or other complementary means can often enhance your life and make the pains that you may be experiencing minimized dramatically.